Prevention of central line associated bloodstream infections, otherwise known as CLABSI, is part of the National Patient Safety Goal 07.04.01. The objectives here are going to kind of familiarize you with how nursing meets the elements or the kind of sub-requirements of that National Patient Safety Goal, how to comply with central line bloodstream infection prevention strategies, and then to kind of know some of the basics so that you're better able to teach and interact with families on ways to prevent them getting a central line associated bloodstream infection, whether that be in the inpatient facility or if they have these lines at home or in other areas they might end up being, like such as a skilled nursing facility or other settings after hospitalization. So there are multiple elements, and elements of performance is kind of like what Joint Commission, who has the National Patient Safety Goals, they will, when they come into your hospital, they will look at how did they meet the standard on this particular element. So an element is sort of a sub-measure of a National Patient Safety Goal, if you will. So in other words, it has many parts to be able to meet that goal. So the first element here talks about education of healthcare workers. It is required that people get educated if they're hired, but also as a nursing student, you are required to get education related to this while in school. If you're getting oriented to a clinical site, that might be a component that talks about how you do infection prevention. And then after you have been an employee as a nurse for a year, you will get annual training. And then anytime a policy on any of these types of catheters is updated or revised, they have to send out more training related to those revisions. And briefly, I'll just mention what these types of catheters are. Peripherally inserted central line catheters, or what we call PICC lines, are catheters that are usually put in by specialized nurses that are specifically deemed competent and trained to insert these. These will not always be floor nurses. Usually they're ones that work in special procedures in a hospital. And they may come and have the patient brought to them in a special procedures lab, or they may, in some situations, come to the patient's bedside and ask you to assist with these procedures at the bedside. So it's important to really know about that process going into med-surg units. Patients tend to have PICC lines in more of a med-surg environment. And so these are catheters also, when it means peripherally inserted, it means that they are literally inserting these catheters in the antecubital area of the arm, and they may be threaded up through the basilic vein or the cephalic vein in those arms, and then threaded all the way up to the superior vena cava outside of the heart. And in that way, there is a easy access to blood, but we know that they're getting the medications and things pretty quickly because of where that is, when you push things through it or run things through it, it's not just going in right at the arm where the insertion site is. It is a very long catheter that goes much further up, closer to the heart. And patients can get, for all these central lines, very centralized effects from the medications and things that go through them much faster because of where they're actually going to than a peripheral IV. The other types of central catheters are central venous lines. You'll see those denoted as CVLs sometimes. And CVLs are usually placed by surgeons or by physicians, and you often see those kind of lines more often in an intensive care unit. occasionally in a ER setting where it was emergent to get a line in somebody, and the PIC team wasn't available. Portacasts are a different kind of line, and you'll hear more about this, but it is actually a surgically implanted kind of port type thing that is put in under the skin and has a little catheter coming off of it that goes into the usually the subclavian vein in the chest area, and it will heal over, after the initial insertion, and the incision will close, and you are able from that point forward to take a needle, a special needle called a portacath needle, or sometimes called a Huber needle, and it is like a hooked needle that's at a 90-degree angle that actually presses down through the skin and into the port, and you hook tubing to that that can be hooked to your IVs, and it also can be accessed with that needle placed in there, and put a syringe on the end of an extension tubing and draw blood through it. And all of these lines are very nice for blood draws as well. And just know that portacasts you might occasionally see on a medical floor, but those are usually put in patients who are going to receive long-term therapy, such as, and the typical population that you would see that for is cancer patients. The next element of performance that we're looking to be in compliance with in a hospital is making sure that patients and families are trained about infection prevention with these lines. So most of the hospitals are going to have a very set, standardized patient education pamphlet or a training module that they watch on Central, Continuing Education TV. But we want to make sure that they're all getting exactly the same information. And this will be down to a lot of the procedural elements, and some of those are very time specific. A good example is we scrub the hub of a port on one of these lines if we're going to put a syringe in it to draw blood, or we're going to put another line in it to give some medication. Before you insert a needle or a syringe into that, you have to make sure that you are scrubbing that hub of the exterior part for 15 seconds, and then you have to allow it to dry for 15 seconds. And so that's one of the easy ones that people will make sure they teach family members. If you ever notice somebody not waiting that full 15 seconds for either one of those, you need to speak up as a reminder, and then nurses and caregivers should be very open to that and encourage them to do that and respond to them with thank you for helping me stay within the guidelines, because that's our ultimate goal, is to be safe. So it's a different way of looking at someone correcting you about what you're doing, but it's really meant to be a team focus on infection prevention. The next element deals with policies and procedures being aligned with the CDC guidelines, and the Centers for Disease Control have very set parameters in the policies on how we manage these kinds of central catheters. So, if there's a change in the CDC guidelines, then every agency has to go back and revise their policies and procedures. And again, since you need to stay up with the most current, then you have to get re-educated on that. So you can anticipate that. As things change, you're going to get notified and you have to adjust your practice ongoing. The next element of performance is talking about the hospital conducting risk assessments for surgical site infections, but they also have to measure central line associated bloodstream infection rates, and for those they have to monitor for compliance with best practices. So, At any given time, you could go in a hospital and ask, what is our CLABSI rate? And they will tell you. And some of that data is specific even to the unit. Like we know 5 West has got this CLABSI rate, another unit's got another rate of infection. And obviously we're monitoring all this and reporting this and making the staff aware of it with the goal of, if we keep a handle on where we are, we're going to constantly be decreasing this and working on getting it better and better and better, which is what has occurred over several years of focus on this. Next element just deals with a catheter checklist and a standardized protocol related to how central line insertions are done. This is to monitor those PICC line nurses who put in stuff to put in lines. Are they all doing it exactly the same way as required? Are they using the maximum barrier precautions? Same thing for the physicians. Often you're going to see this checklist is in the electronic medical record, and if you're the nurse that's assisting somebody with this procedure, then you're going to be the one usually that is doing the checklist to monitor that everything was correct in the electronic medical record. So if you do sit in on one of these and help with one of these in the future, make sure that you're going back and covering that and documenting properly. These next couple slides just really have a lot of procedural reminders, and I'm not going to read all those nuances, but do pay really attention and spend some time really scrutinizing the frequencies of some of these. I don't anticipate set questions on every single part of this because it is very prescriptive, and if you're not taking care of these types, you're not going to know all that. The main point to take away is there's very specific procedures that have to be followed to the letter in terms of timing, what comes first, how often something's changed, and so every time you have a patient like this, refamiliarize yourself with what those need to be. Here's just some more that kind of talk about dressing changes and tubing changes, and you do have a really nice video to watch that gives you some good examples of how some of this is done. A standardized kit has to be used for central lines. Years ago we had all kinds of different kinds of insertion kits, and so one doctor would do it one way, another person would do it a different way, and so now all the kits have all the exact same supplies in them so that everybody is doing exactly the same thing, and it really gets back to maximum barrier precautions being used, really a focus on sterility and that everything is done precise when it's being done. The next one talks about chlorhexidine antiseptic being used for skin prep. The video that you've got to watch from those new graduates that did the shows that very, very nicely. Pay attention to how they use that and how they activate it and how it's scrubbed. It's not something you do in a circular fashion. It's really to activate it good on the skin. You have to kind of do more of a scrubbing motion. And so another part of meeting this is to make sure that when you have CVL dressing kit changes that you use sterile gloves and how you change the dressings, and masks are worn during dressing changes. You as the person doing the dressing change would wear a mask, and you will put a mask over the patient's face so that they're not coughing or something onto the site that would make it not a sterile site as well. The next element talks about how we access or put a syringe into a hub or injection port that's in a line going to these things. And so watch how that is done, but that really is talking about how these little injection ports are cleaned properly and some of that timing that I was talking to you about earlier. The last one deals with central lines being reviewed routinely for necessity. So, if you have a patient, every day that you go to do their assessment, if you list that they have a central line, you're going to have a question there to say, are we still using this line? Because if they could do without it and have just a peripheral IV, and that's potential, then we need to make that switch and notify the doctor to get a discontinue order. So those are the standards. Hopefully you have a better overview of that.